In transposition of the great arteries, the body and lungs run in two separate loops. Oxygen never reaches where it's needed. It's a neonatal emergency that looks deceptively normal at birth. Let's understand the science and life-saving surgery that changes everything. So normally what happens is that aorta arises from the left ventricle and pulmonary artery arises from the right ventricle. In simple terms, in this disease, the two great arteries switch their places, creating two parallel loops instead of one connected loop. This means that oxygenated blood continues to circulate back to the lungs, while the deoxygenated blood circulates throughout the body, leading to profound cyanosis or blueness in the child. So the signs and symptoms. Normally what happens is that child is not blue when he is born, but here the child suddenly turns blue and becomes unresponsive to oxygen therapy just minutes or hours later from the birth. The signs are central cyanosis, no significant murmur unless VST is present, loud single S2 because the aorta is positioned interior and closer to the chest wall, signs of heart failure if associated with VST or AST. Chest X-ray is very important and shows egg on a string appearance because the heart becomes globular and becomes like an egg and the narrow mediastinum becomes like a string. Echo is gold standard and show great arteries arising from the wrong ventricles. Prostaglandin E1 is given if there is concomitant PDA present to keep it open until surgery. An arterial switch operation is done within first 2 to 3 weeks of life that switches the two arteries back to their correct positions. So now the USMLE style question. A 2-day-old male neonate presents with central cyanosis, tachypnea, and poor feeding. He was born at term via SVD with no complications. On examination, he had a loud single S2 and no murmur. Oxygen sats remained low despite administration of 100% of oxygen. Chest X-ray shows egg on a string appearance. What is the next best step in the management? So the answer is prostaglandin E1 infusion. That is the best next step to make the child survive, and the definitive answer is surgical correction with arterial switch operation. So you have to see that what the question is asking. Is it asking the best next step or is it asking the definitive procedure? So it was Dr. Yumna here. If you like my videos, please subscribe to my channel and have a very good day. Thank you.